Yep. So the Murano trial is a randomized trial, uh, and the standard arm of therapy in the Murano study is a regimen called BR, which stands for bendamustine and rituximab. And bendamustine is a type of chemotherapy, and rituximab is a monoclonal antibody against the CD20 protein, which is expressed on CLL cells. So it's an antibody therapy in combination with chemotherapy. And the new therapy was the Venetoclax, which is a BCL2 inhibitor. It's a tablet, and that was taken in combination with the rituximab antibody. And so the Venetoclax and rituximab combination, of course, is a chemotherapy-free treatment approach. And it's given with what I refer to, oftentimes people say, a fixed duration therapy. So some previous targeted therapies in CLL were designed to be taken continuously over long periods of time. And here in this study in Murano, what we're evaluating is the ability of fixed duration, chemotherapy-free treatment, and how that can help patients compared to randomized against chemotherapy, bendamustine Rituxan. And so, we knew previously from earlier updates that the combination of venetoclax and rituximab can help patients achieve deep remissions, even what's referred to as minimal residual disease or MRD clearance. And what these analyses show is now with 5 years worth of follow-up, not only are remissions common and deep, but those translate now to long-term disease control. So allowing patients to have a fixed duration of therapy, an extended period of time off of therapy, and then remaining progression-free and with encouraging survival, even 3 years after the conclusion of their therapy for previously relapsed CLL. NCCN, the National Comprehensive Cancer Center Network. Within there, they provide some recommended guidelines for treatment of different tumor types and different situations. And in their recommendations for patients who have CLL and are previously treated, they already include as a Category 1 recommendation to consider venetoclax plus rituximab for those patients. But I think with these data, whereas before, you knew that you were confident patients had a good chance to achieve a deep remission. And we certainly were optimistic and believed that those deep remissions would translate into really durable responses. And so I think with these now 5-year follow-up outcomes, we can have confidence because we see the results that indeed achieving deep remissions frequently, we are seeing it translate into improved long-term outcomes for patients, even 3 years and more off of actually being off of active therapy.